generally for your knee, like, and it is positions where we're slightly, like, it's putting our bodies into a little bit harder positions to hang out in. So if you're not comfortable on your knees this long, that's not good, because it's only going to be for a brief amount of time. It's not like I'm going to keep you here for an hour. It's 6.5 minutes. So each direction is going to be 6.5 minutes. So if I was working on her other knee, I'm going to be same exact position, and then for one way, I'm going to be sitting in between her legs to pull everything the opposite direction. For her left knee, because she wants her left worked, I'm going to be face to face here, and then I will just be face to feet right here. Just a quick pivot, sitting, nice and relaxed, super easy. So, the knee is 4 main sections. We have the top, quad, over around the patella, to the patella tendon, and then we have the sides. That's why I kind of read a little confusing in the book, because it's like, do it from one side, flip sides, and then flip the client over and do it from both sides, and you're like, oh wait, what? It's literally saying what I do on one side though, I'm going to do the exact same thing on the other. I'm going to demo what that all looks like first, before we flip her over and get her onto her stomach in prone position, so we work on the hamstrings and the calf a little bit, and then directly behind the knee. So we have our quad muscles right here. Generally, when I'm doing a knee, and I don't care if it's been a knee replacement or you're just doing a bad knee itself, I'll only work about 5 to 6 inches above. You don't need to come any higher. This is not affecting the knee itself. If they have scarring, like I have an old client, he got in a mountain biking accident, he got a tree branch lodged up his thigh, and so like the scarring was coming all the way through, and so that was kind of like impeding the movement of his knee himself. So I started from the top of the scar to open up that muscle belly. But generally, if there's no like surgical scars or major any issues that you see happening, 5 to 6 inches above to 2 to 3 inches below. No more than you need.
Well, except what we just did, those muscles attach down here. And so it does tug on your knee.
Yeah, but like then if that's something I'm going to be noticing because they're having a hip issue. If they're having a knee issue, you're going to focus on the knee.
Okay.
So if they were like, that was going to be the origin insertion kind of thing that we were reading last with the hip, like, oh, I get low back pain, it comes into my hip. We have origin and insertion. If you're talking about knee issues, but you're talking about hip issues as well, origin, insertion. So knee issues would be just focus on the knee. So we got our quad here. That's going to be a nice big muscle that we work. When we work muscles, we just want to make sure we're cleaning, and I don't care if you strip it section by section or you go side to side. There's no right or wrong, but it's just going to be covering the middle, the medial, and the lateral. The medial side, mindfully, I know it is always more sensitive because we're always taking damage and we're touching on the outside. We don't really touch the inside too much, so the client will be reacting more. So be mindful of that when you see it. Then we have a large tendon right here, which helps extend that leg. This guy is super important to focus on if they feel like they have like mobility issues and strength issues, kind of like squatting down a little bit. We're going to focus on the hinge as well, but that quadricep tendon right here, very important. We have vastus medialis on the inside, vastus lateralis on the outside. We have the patella itself, that's just your kneecap. And then we got this big tendon down here that you can see as I push, that pushes back. That's going to be the patella tendon that connects down. So if you feel like you're really, like you have instability issues and like you don't feel really fortified while you're standing, more focus towards the lower section. So as I go to work for the first main position where I'm sitting like so, I'm not on her foot either, I'm on my heels. So I'm sitting on my heels and my knees are on either side, just so I have strength here. And I'm able to get my body weight directly over top, so when I fall, I'm not coming from shoulder strength and I'm not damaging myself. It's just going to be my body weight doing the work for me. So first main position, this is going to how she's going to be sitting before I get her on her sides to do the sides. So I'm going to start 5 to 6 inches above, and I'm going to work the middle, the medial, the lateral, as I plow my way down towards the patella. Then I focus on that quadricep tendon for at least a minute to 2 minutes. Open up that quadricep tendon, and then this is where I'll see a lot of practitioners trying to stem all the way out and get the sides of the knee. Don't do that. We're going to get them on their sides to do the sides. So I want you sticking to the ledge of the patella, and most of the time you will be able to feel it. Some people you won't feel any ledge at all because there's so much calcification now filling in that crevice that should make up that definitive like indentation along the patella itself. So once I work down the middle, the medial, and the lateral through the muscle belly, playing more windshield wiper and a little bit longer strokes because it's a larger muscle, so you can plow and windshield wiper this. Then when I get to the patella itself and the knee, I'm going to go scaling and pinpoint, and I'm going to scale all the way around the ledge of that patella. Down to the patella tendon, focus there for another minute or so, and then continue your way up.
Okay.
That should take you about 6.5, 7 minutes. Then you're going to flip around and go face to feet and pull everything back up. Same thing, just opposite direction, pulling like up, 45-degree angles. Right now I'm pulling down, 45-degree angles. So far so good with that? Beautiful. Generally, I'll show you one side with a bolster, and then I'll show you one side with your body. And if you wanted to use your body for the complete thing, it would just be opposite. And so I do both sometimes. It just depends on the client's limitations, I find. So I want to go to the medial side first. I'm just going to pivot that bolster slightly, and she just slightly out-rotates that leg. So now we're in a good position. After I finish the top portion of the knee, I technically would have finished face to feet, correct?
Mm-hmm.
So I would have been now on this angle, facing this way. And I don't want to see, when you go to get them in that medial position, I don't want to see that the knee's encased. Once again, it's like the hip. I want it opened up a little bit like so. So we can work, I call this the hinge because that's right where it hinges at. And so we're going to go in and really focus on the whole side of the knee, working from the patella all the way to the cusp of it, right before I'm falling off towards the backside. We'll get the back later on. So I'm going to be starting, once again, 5 to 6 inches above, being mindful that medial side is going to feel pretty lively as I go to work it. So I am going to start 5 to 6 inches above, working through vastus medialis, and I'm going opening up these muscle fibers. When I get towards where the knee is at, I want you working, I'm going to be pulling everything up and in. So I'm using the side of that patella as a backboard. And I'm going to be kind of grinding out all along that bone in a loving way to pull those fibers apart that are binding up in here. Then I'm just going to continue my way down to do about 2 inches below. I don't want to see you too far down on the calf. We're going to be separating that with the low leg treatment. I just want you working 2 to 3 inches below, making sure you're hitting the side of that patella tendon. So once I've worked that from face to feet and face to side, then I'm just going to flip myself around once again, and I'm going to pull face to face and face to side. So I pulled everything up and in, and now it's down and out.
That
Pretty
looked like in.
Hmm?
That looked like in.
This would be out. That would be in. Depends on what your in is, but if that patella is the main, on that side, does that make sense? I pulled up and in, and then on this side, if I'm pulling down and towards me, would be out away from the patella.
Okay.
Make sense? Okay. So, once I have done that, that's going to be one side, complete. I did all 4 directions. Then I'm generally going to, and the reason why I go to the medial side first, and it's easier, because the hip can rotate that way a lot easier than it can in turn. So then we're going to flip her completely into fetal position, and I tuck the bolster to the other side. But this is where I'll show what my body looks like. But that's how it would sit with the bolster. And I'm going to, once again, pull everything down and in, and then, because it's opposite, and then I would flip over, and I would be pulling everything up and out. But generally, I like using my body when it comes down to knees, because the client also feels more supported. They can tolerate a little bit more. It's not that full separation. So when we're doing the knees with your body, you just have to mindfully remember, I'm going to be in between their legs on one direction, and I'll be outside of their legs on the other direction. So as long as they're comfortable with that too, which 90% of the time, if somebody's coming for a severe issue, they're going to be comfortable with it. They're like, hey, this is the best for me to do the best work. Most of the time they're going to be like, sounds great, do what you got to do. But you always ask. So you'd be like, hey, do you mind if I like sit in between your legs? Once again, that's great. So this is where, because their leg is going to be lying on top of your lap. Even if you wear pants, I want a towel over top of your lap for separation. So one of their legs is going to kind of shoot out like so. And I'm going to just tuck myself in. So this is kind of like I become the bolster. So when I go to do this, if you're a smaller body and you're working on somebody with long limbs, support their foot, because I don't want it flopping around as I'm working, because then it's going to put tension in those tendons, ligaments, and muscles where I won't be able to get in as well. and just adjust yourself. Tuck up to where you need. So I'm tucked right up, and I'm going to start once again 5 to 6 inches above, and this is going to be mindful, guys, if you're working the same side that we just did for hips, that's the iliotibial band, so you might have to kind of skip over it a little and shoot a little bit lower down if they're already sensitive. So 5 to 6 inches above, I'm going to work the middle medial lateral of the muscle belly, but my focus is when I get to the knee, working into the patella and opening up the hinge all around it down to the patella tendon. And this is technically, because I'm on an angle, it's like face to face-ish, face to side. Then, so since I'm in between her legs on one way, I'm going to lift up, flip myself around, place on top of my lap, and I'm face to feet-ish, face to side. So now I'm pulling everything up and out instead of down and in. And I will begin 3 to 5 inches above to 2 to 3 inches below, playing that windshield wiper, focusing by the patella, using that patella and the bones around the knee, because like this is where people are going to have the ACL, MCL, and PCL tears. You can't get inside the knee, so you're going to be really cleaning out what's built up around it, and then you'll also get it decently if their lymph isn't like inflamed at all from the backside, if they can tolerate that pressure, but we'll see when we get there. So once I've done this, face to face to side, face to feet, and face to side-ish, then we're going to finish off with essential oils and a nice effleurage massage before I rearrange the bolsters and we focus on the backside. Are we okay with that direction so far though, everyone? Okay, so we're going to get her on her back first, and we're just going to go through those 3 motions.